In this video, I'm going to demonstrate the method I use to check flexibility for the pec major and the pec minor muscle. So we oftentimes find that when people have that excessive rounded shoulder from sitting on a computer for hours on end, we tend to find a typical posture where their shoulders are kind of raised forward or rounded, right? So you find that you'll find the shoulders in this position as opposed to relaxed where the shoulders are down resting on the treatment table here. So to measure for the pec major, this is what I like to do. Oftentimes, I shall get my patient's arm straight up as if they're trying to reach towards the ceiling, and think about horizontal abduction, right? So, and then I try to drop the arm to the side there, right? And basically, I'm trying to look for the arm reaching the level of the table here. If you find that the patient's arm arm tends to stay up a little bit, then they might have some stiffness there. I'll also check that in a different angle where I get the arm closer to about a 45-degree angle. A little above 90-degree angle in that plane, and then drop the arm down towards the bed. And again, what I'm really looking forward for is the arm to rest on the table. For some people who might have that rounded shoulder, you might find that their arm is kind of stuck in this position, doesn't really go down. And that could be because of a little bit of tightness in the pec muscle here, especially the pec major. Now, for the pec minor, it's a bit different because you want to assess whether it is a true stiffness or tightness that is coming out of pec minor or some of the other structures like the bicep or the coracobrachialis. Now, to measure the flexibility of the pec minor muscle, you want to measure or palpate the posterior border of the acromion right here, and you want to see the difference between the posterior border of the acromion and the table. And generally, the normal value should be anywhere between 3 fingers, I'd say. Now, if you have a patient who you suspect could have pec stiffness, and you find that the shoulders are still elevated and it's definitely way more than like the 3 fingers here, so the next thing I do is I want to rule out if this tension could probably be because of the bicep brachii muscle, right? So the way we want to do this is we'll have the patient initially, like, her arm is straight. I'll have her flex it all the way. So go ahead and flex your elbow all the way there, Pooja. So now, as she flexes, if we see a reduction in the space here, right? So now if her shoulder drops down, that tells me some of that contributing stiffness was probably coming from the bicep muscle here. However, if there's no change and you still find a lot of gap between the shoulder and the fingers there, then the next muscle you probably want to check is the coracobrachialis. And for this, we would passively raise her arm up, right, in that position. And now if you find like the shoulder, the posterior border of the acromion drops down a little bit, then mostly the stiffness that we felt in the shoulder was maybe coming from the coracobrachialis. But however, if you did that and you still find that there's a lot of room, right, then that could be a true pec minor stiffness.